Hello. Hi everyone. Am I audible and visible? Okay, hello. Good evening. All right. Okay, so this is a short, quick session now where we are going to talk about some PSM MCQs, okay, which can come in your exams. Now, as the exam has been postponed, everybody, but that doesn't mean that we should not study and we should stop studying, because if there's anything left for you to still revise, or you wanted to revise something earlier and you couldn't revise it, okay, so now is the time. We must continue with the same spirit, okay, and let's hope this session also helps you out equally. Okay, so before I begin, just a quick reminder, please remember Unacademy is conducting a MedMinds Ultra Combat 2.0, which is going to be a live test. It will contain 50 questions in 60 minutes, and there's going to be separate set of questions for the first year students, second year students, third year students, fourth year students, intern as well as post intern. So you don't have to really worry about it. You just have to click on the link and enroll. The link is there in the description box also, and you can use my code PSM10, everybody. Okay, use my code PSM10 to enroll as of now itself. All right, so use this code. Okay, and I'm sure it's going to help you out. 27th November, 12 p.m. You're going to win exciting prizes: a MacBook, iPad, mobile, Kindle, smartwatch, stethoscope. So a lot of prizes are there. You just have to click on the link which is there on the description box. Use PSM10 to enroll. Sure, we'll talk about the best way to start reading PSM for 2023 exam. So see, if you're preparing for 2023 exam right now, before you start reading anything, just look at the previous 3 years questions. Okay, both NEET PG also and FMG papers also, because they are equally good, and the questions many times get repeated in both the exams. So give a look at the questions. You'll understand what sort of topics are getting repeated, what sort of questions are coming, and then you start reading your notes in that order of importance. Okay, that's one of the good things. And then again, sit down to do your like, once you've seen the PYQs, you get an idea, try doing them. That goes for FMG exams also. Now that it has been delayed, okay, you can just look at the previous year questions for 2 to 3 years. Based on that, you can figure out the most important repeated topics, give a reading to that, and again go and do the PYQ. That's one of the best ways, okay. Also at Unacademy, we have given out a MBBS Prof 2 package. Okay, this is for 3 months, live batches, recorded content, everything is available. So again, to enroll, you can use my code PSM10. And there's a NEET PG revision batch which is starting. Okay, Achievers batch it starts from 21st of November. Duration is 4 months. Okay, and it will be a rapid revision with MCQs, image based, previous question, topic wise test, subject wise test, grand test, mentorship session, and doubt solving sessions also. Again, you can use my code PSM10. It is available only at a price of 12,250. Okay, so that's one good thing which will help you revise your PSM at the last moment. Okay, all right, so now FMG का भी exam delay हो गया, so FMG students can also think about if they want to become a part of this batch. Okay, so let us start with some quick look at some of the questions, everybody. Okay, so the first question over here is, incidence is best measured by some of the most common things that we can expect in FMG exams. This can also come in your NEET PG, guys. It's nothing like this cannot turn up in NEET PG. Yes, we all know incidence is cohort. हमें पता, we'll try to look at maximum number of questions. Incidence is cohort. And what about prevalence? What about prevalence, guys? What about prevalence? प्रेवलेंस किस स्टडी डिजाइन से मेजर होता है? व्हाट अबाउट प्रेवलेंस एवरीबॉडी? प्रेवलेंस इज मेजर्ड फ्रॉम व्हिच स्टडी डिजाइन? टेल मी इन द कमेंट सेक्शन. Prevalence, very good Alia. Prevalence is measured from cross-sectional study design. Okay, a few golden points here. Which study design will help you study multiple outcomes? Multiple outcomes. Which study design is going to help you study multiple outcomes, everybody? Multiple outcomes. कौन सी स्टडी डिजाइन तुम्हें मल्टीपल आउटकम्स पढ़ने में हेल्प करेगी? वेरी गुड, मल्टीपल आउटकम्स. गुड मनीष, इज कोहॉर्ट. एंड इफ आई आस्क्ड यू मल्टीपल एक्सपोजर्स एवरीवन, मल्टीपल एक्सपोजर इज विच वन? you go back from effect to cause. So multiple exposure is case control. Okay, so these are just some golden points which can come as one liners in FMG exam also, NEET PG exam also. ठीक है, incidence कैसे calculate होता है, prevalence कैसे होता है, with study design, multiple outcomes किससे पढ़ते हैं, multiple exposures. Okay, next question. A 30-year-old male truck driver visited to the clinic with fever, skin rash, swollen glands and fatigue. The physician referred him to Suraksha Clinic. Which among the following is included in provision of services at Suraksha Clinic? Suraksha Clinic has come before also in FMG exams. It can get repeated in NEET PG. So we know it is reproductive tract infection या STI services. Okay, so Suraksha Clinic provide us facilities for RTI and STI services. ठीक है, just look at the logo of Suraksha Clinic. It's white with a red dot in the middle. Okay, so this is sexual and reproductive health services. It provides diagnostic services, treatment services, also preventive services. So that is important. Suraksha Clinic. Chalo, next. Okay, one more thing. Suraksha Clinic is an initiative of, please remember, it's an initiative of National AIDS Control Program, not Ministry of Health and Family Welfare. Okay? So it's an initiative of National AIDS Control Program and it is providing us with STI and RTI services. Okay? Okay, let's go to the next one. Additional energy requirement during pregnancy, one of the very commonly asked questions in FMG exams as well as our NEET PG exams. Batao, very good. Plus 350 during pregnancy. देखो guys, ideally ना first trimester में extra calorie नहीं चाहिए होता है. Ideally in the first trimester extra calorie is not required. ठीक है, but a National Institute of Nutrition has laid down certain guidelines. See over here, this energy guideline has been given by National Institution of Nutrition. Hyderabad is its headquarter. Okay, now according to this, during pregnancy plus 350, first 6 months of lactation plus 600 and 7 to 12 months plus 520, and there is no change in pregnancy and lactation energy requirements. Okay, कोई भी change नहीं आया है pregnancy and lactation energy requirements from previous guidelines. Okay, for pregnancy and lactation there has not been any change. Since they ask this, they can also ask sedentary, moderate, heavy worker, male and female, how much energy do they need? So just look at this chart. How you can remember is, whatever is the energy required by sedentary man and moderate man, okay, which is like 2100 and 2700, the same amount of energy is required by sedentary female 2100 and 2700, moderate worker female and heavy worker female. So that's how you can remember. 2100 is the energy required for sedentary worker man and 2700 for moderate worker man. And the same energy 2100 and 2700 is required for, which one is required for moderate and heavy worker female? Is it clear everybody? ठीक है, that was the earlier one. Okay, ठीक है, now we are going to follow this one. Okay everybody, और यहाँ पे 1660 को कर लो 1700, just double that, you will get 3400. ठीक है, so that's a very very important thing. Please don't forget this. This can be asked to you in your examinations. Okay, according to the new updated guidelines. Chalo, very important for FMG and NEET PG. Everybody, can you tell me the answer to this? Peripheral blood smear for malaria. This is मतलब वो बोलते हैं ना a favorite PYQ. Okay, it's like a favorite MCQ of examiners in any exam. ठीक है? So peripheral blood smear for malaria is done by, very good, male multi-purpose worker. Now where is this male multi-purpose worker posted, everybody? Posted at a sub-center, right? So now what are the duties of a male multi-purpose worker? Many times they ask you male multi-purpose worker, or you can also call them as a male health worker. Same thing, okay? Multi-purpose worker as well as a health worker. It's absolutely the same thing. And what are the responsibilities of a male multi-purpose worker, guys? Number one is the one which is asked to you in your exams. Okay, peripheral blood smear preparation. Okay, then what is the next one? Chlorination. Okay, chlorination. Okay, and what is one more? Collect. Yes, here you can also say prepare malaria slides. Okay, it's the same thing. Prepare malaria slides. Then collect sputum sample. Please remember, these are very, very important functions of male multi-purpose worker. Okay, prepare malarial slides, chlorination, and as well as collect sputum samples. And what is a function of female multi-purpose worker? Female multi-purpose worker can also be called as a female health worker, or she can also be called as an ANM. Okay? So what is her work? Number one, register pregnant females. Please remember, registration is not a work of Asha. Asha, she just has to bring the pregnant females to the sub-center. Okay, she's a mobilizer. But registration is the work of pregnant female. Immunization दोनों कर सकते हैं आलिया. So right now we are talking about the particular functions of male and female. Okay. Register pregnant female, conduct delivery, ठीक है, do blood and urine examination, ठीक है, do a blood and urine testing or examination she can do, maintain eligible couple register. Okay, maintain eligible couple register. So these are some of the most important functions of a female multi-purpose worker. ठीक है, maintaining eligible couple register, that is again an important function of a female multi-purpose worker or an ANM. And what about both male multi-purpose worker and female multi-purpose worker? दोनों के लिए common functions क्या है? Both of them can inject a vaccine. Okay, can give a vaccine. Immunization. They can both distribute contraceptives. Okay, they can both distribute ORS. All right. Both male and female can talk about immunization, distribute contraceptives, distribute ORS, and also they can identify suspected cases of communicable diseases and non-communicable diseases. Okay, they can identify suspected cases of CDs, communicable diseases as well as non-communicable diseases. Okay, but mostly in the exams you are asked about male multi-purpose worker, which is prepare malarial slides, chlorination, collect sputum sample. Female multi-purpose worker के लिए register pregnant females, conduct delivery, do a blood and urine examination, and also maintain an eligible couple register. Is it clear, everyone? Can we go to the next question? Okay, these are important things which can come in your exam. Okay, just an important thing about ANM. Okay, all right. So when you talk about an ANM, okay, so all right, now we know that ANM is located at a sub-center. Okay, so she is located at a sub-center. Education, 12th, ANM or a multi-purpose worker, male. ठीक है, both. ठीक है, multi-purpose worker, female. Education, they have to be 12th pass. Okay. Population 1 per 5,000 in plain area and 1 per 3,000 in hilly area. Okay. First introduced by which committee? ANM. ANM was first introduced by Kartar Singh Committee. Okay, multi-purpose worker scheme was introduced by Kartar Singh Committee. Okay, Kartar Singh Committee ने introduce किया था. And training is also 12-month duration. Okay, 12-month duration training. These are some of the important points about multi-purpose worker, male and female. ठीक है. देखो मनीष, ऐसा होता है ना कि when you talk about sub center, there is A and B. Okay मनीष, sub center A there is no delivery. ठीक है. Sub center B delivery happens. So wherever delivery happens, there are provision of 2 beds. Okay. A में we have not spoken about any bed. ठीक है. B delivery is happening, so 2 bed. All right. Okay, let's move to the next one. Contraindication of the device shown. Again, this is one of the favorite, like, MCQ which keeps coming in exams. What is this? First of all, we all know this is an intrauterine copper device, IUCD. Which copper device is it? Could you tell me which copper is it? Because this is brown color copper wire, right, which is wound on the horizontal and vertical stem. So this is copper T380A. Okay, copper T380A. 380 millimeter square of copper wire is wound on the horizontal as well as the vertical stem. Now contraindications. Breastfeeding, no. Breastfeeding में आप आराम से IUCD लगा सकते हो. Okay, because copper, it's non-hormonal, so it's not going to interfere with the lactation or anything. ठीक है. Monogamous. Can you put IUCD in monogamous? Yes, because you cannot put IUCD in a woman who has a polygamous relationship, meaning multiple sexual partners, because that can increase the risk of PID. Again, someone who suffers from hypertension, you can easily put an IUCD because it is non-hormonal, it will not do anything. But PID is an absolute contraindication, everybody, okay, because that increases the risk of infection. See, absolute contraindication: suspected pregnancy, vaginal bleeding of unknown cause. Active PID is absolute contraindication. Cancer of the cervix, uterus and other pelvic tumors, okay, that, and previous ectopic pregnancies, they are also absolute. Now here only you can write relative. See, how will you understand relative? यहाँ पे suspected pregnancy था, so relative में instead of that you have anemia and menorrhagia. Okay, you have anemia and menorrhagia. Now why anemia is a relative contraindication? Because the most common side effect of IUD insertion, everybody, is what? Is bleeding, right? So if any woman is anemic and the most common side effect is bleeding, it can harm the woman. ठीक है. फिर यहाँ पे vaginal bleeding of unknown cause, but on this side it is what? It is cervical discharge. Okay, here it is cervical discharge. Here it is PID. Okay, a past history of PID again becomes an relative contraindication. ठीक है, any past history. So you have to be very careful with that. ठीक है. Yes, second most common side effect is pain, and pain is the most common cause of removal. Then previous cancer of the cervix uterus की जगह, here we are talking about congenital malformation or maybe fibroids. ठीक है. Previous ectopic pregnancies are absolute. ठीक है. Unmotivated person. All right. Why unmotivated person? Because the person has to feel for the thread. Okay. If she doesn't feel for the thread, she has to always examine whether she can feel the thread or not. Otherwise, maybe it has got displaced, okay, and then we need to tackle it that way. Clear? Contraindications, everyone, it's one of the most favorite question of examiners. Okay, again a favorite expected topic is identification of mosquitoes in FMG exams, also NEET PG. So mosquito having spotted wings, everyone, what is the answer? Very good. Anopheles, right? So how do you identify? Look at the adult mosquito. Okay, if the mosquito is sitting at an angle of 45 degree, I'll show you the image, plus has spotted wings. Okay, if the mosquito is sitting at an angle of 45 degree plus उसके पास spotted wings है, ठीक है? So what does this become? Anopheles. Okay, all right. ठीक है, tiger mosquito is not spotted. You will just say white stripes. Okay, I'll show you the image. Spots and stripes are two different terminologies. Okay, ठीक है, अभी I'll show you the image. ठीक है, and if the mosquito is sitting at an hunchback manner, ठीक है, like this. Okay, so if the mosquito is sitting in a hunchback manner like this, now this can be two things. Either it can have a white stripe on black body. Okay, so when it has white stripe on black body, it is Aedes. Okay, that is why it is also known as tiger mosquito. And here there is no white stripe on body, plus there are also long legs. Okay, so what is this everybody? Culex. Okay, no white stripes on body plus long legs hai, so that is Culex. Ab keep this in mind and look at the mosquitoes. What is this first one? A mosquito kya hai? Ab keep this in mind and look at what is the first image? A. Very good. Now this is hunchback. Okay, and there are white stripes on the body. So this is Aedes. Now look at this. This is hunchback. Here it has long legs. Okay, it's crawling on the floor, on the surface like this. If you tilt it, you will see that this is again hunchback. Okay, this is again hunchback. So this one right here is Culex. This one right here is Culex. But look at this. It is sitting at an angle of 45 degree. Okay. And what can you see? White stripes are present throughout the body of Aedes. Okay. Don't say it's not present here or there. It's present throughout the body. Okay. But if you look at this, sitting at 45 degree, and these are spots. Okay, on the wings. So these are spotted wings. So what is this everyone? This is Anopheles. Okay, ये क्या है? Spotted wings. Okay, this is Anopheles. But if you look at this one, this is brown or black. Okay, and here you can see only there are white shiny this thing. Okay, so this is what? Only white spots or on the legs. Okay, shiny thing. This over here is Mansonia. Exactly, you're going to get this picture only. All right, so please be very careful. Just look at how the mosquito is sitting. Okay, and then accordingly you have to figure out. Okay. So this is the adult mosquito. What about the eggs, guys? अब देखो, if you talk about Anopheles, okay, Anopheles के eggs कैसे होते हैं? Single boat shaped lateral floats. It's like this. I'll just draw it for you. Now you know Anopheles breathes in clean water. Okay, Anopheles breathes in clean water, right? So it's also known as sophisticated mosquito. What is it known as? Sophisticated mosquito. So it's breeding in clean water, also known as sophisticated. So it likes to enjoy a boat ride. Okay, it's laying its eggs singly. Plus they are boat shaped with lateral floats. Okay. Now Aedes we all know is artificial collection of water, and it's artificial collection. Okay, and the important thing on Aedes is that we are letting the mosquito breed. We left water here and there, and so the mosquito is breeding. So just like humans smoke a cigar, Aedes also The eggs are something like this. Okay, single cigar shaped eggs. Okay, single and cigar shaped. But we all know Culex breathes in dirty water. Okay, Culex किसमें breed करता है? Dirty water. So it is like a nuisance mosquito. Okay, it's a very big nuisance. Okay, so this is laying its eggs like this in clusters. Okay, in rafts, and there are 100 to 250 eggs in one cluster. Okay, what about Mansonia? Mansonia is like this star. Okay, Mansonia is like a star. तो ये हो गया तुम्हारा Mansonia. Okay, what is this? Mansonia. Mansonia eggs is how? Mansonia eggs is star shaped. Okay, star shaped is Mansonia. Clear? Don't forget these things. And of course, if you talk about the larva resting parallel to the water surface like this. This is Anopheles. This has no siphon tube. Okay, there is no breathing tube or siphon tube present. But if there is a breathing tube like this, it could be either Culex or it could be Aedes. Culex has a slightly longer siphon tube and Aedes has a short siphon tube. Okay, so remember these important points, guys. It can definitely turn up in your exams. Okay, how to identify the mosquito, how to identify the eggs and the larva. Okay, so this is the adult mosquito. Here we have talked about the eggs, one of the most repeated last minute topics for exams. Okay, chalo next one. A specific package of intervention and services which are given to population, those who have either high risk of HIV or those who have reported high risk of HIV, is known as targeted interventions. So which of the following group is not involved in this intervention? I mean, for which group we don't have targeted interventions? Let's have some more answers. Very good, everybody. Now, if you try to understand it, it's very simple. If I ask you, doctors are at high risk for HIV? No. Doctors and professionals को क्या होता है? Accidental exposure. Okay, accidental exposure. And that could happen maybe during a needle prick injury. Okay, so doctors and nursing professionals end up having accidental exposure. Okay, they are not high risk. And remember one thing, TIs, everybody, targeted intervention. Okay, targeted interventions are specific group of interventions. Okay, what are they? They are specific group of interventions which are directed towards high risk. Okay, and doctors and professionals and nursing professionals are not high risk. So you can have TIs for migrant laborers, street children, long distance truckers. So look over here, groups with high risk of HIV are commercial sex workers. Okay, over here there is one more, MSM. MSM matlab men having sex with men. Injecting drug users, truck drivers, migrant laborers, street children, transgender adolescents. All these can be at high risk. So we have directed our specific interventions or TIs towards them. Like female sex workers the National AIDS Control Program, okay, NACP, is distributing condoms. Okay, female sex workers, National AIDS Control Program is distributing female condoms to them. Okay, National AIDS Control Program के अंदर female sex workers को we are distributing female condoms for their own protection. All right, drug users के लिए we have what is known as opioid substitution therapy. Okay, opioid substitution therapy, that is also being done for. So these are all specific group of interventions. Doctors and nursing professionals के लिए नहीं है. ठीक है. One question, if a doctor gets an accidental prick, okay, he was doing FNSC, got pricked, और डिलीवरी कर रहे थे, एपिजियोटमी लगा रहे थे, there was a needle prick injury. What are the drug of choice for doctors and nursing professionals? Who remembers? Post-exposure prophylaxis. Which drug is used for post-exposure prophylaxis in case of doctors and nursing professionals? Who's going to tell me? Not TEL, Alia. TEL is used for anyone who's HIV positive. Okay, that is the choice. No, Lakshmi, according to the updated guidelines which we have discussed in our program classes also, everybody. No, P क्या है? TP? No, it is tenofovir, lamivudine and dolutegravir. This is dolutegravir. All right, don't forget this. See, anyone who comes HIV positive has to be put on tenofovir, lamivudine and efavirenz. But for post-exposure prophylaxis हम लोग क्या दे रहे हैं? TLD. Tenofovir, lamivudine, not TED, TLD, tenofovir, lamivudine and dolutegravir. Okay, and this should be given within 72 hours. Okay, started within 72 hours, and the sooner the better. So best results कब आएंगे? Best results आएंगे if started within how many hours? Best results if started within 2 hours. Okay, so you should give TLD within 72 hours and best results होता है अगर आप इसको start कर देते हो within 2 hours. Clear? So we've done a few questions from HIV which is important. Now of course you will get a BMW. ठीक है, biomedical waste का question. This is also one of the favorite. Okay, no, it is given not for so much. It has to be continued for 28 days. को इसने पूछा राफिक. Okay, continued. Let me write it here. Continued for 28 days. It should be given within 72 hours. The sooner the better. So if you give it within 2 hours, that's a good thing. Plus, it has to be continued for 28 days. Okay. All right. Human anatomical waste, yes, everybody human anatomical waste is yellow. ठीक है, yellow category. Like there's a placenta, discarded fetus, okay, any histopath organ which has to be discarded and all that. So they go into yellow color bag. So yellow category में anatomical waste, animal waste, soiled waste like bandage, okay, like bandage, or you have cotton swab. ठीक है, cotton swab हो गया, or you have gauze piece. All these are going to go into yellow colored waste. Discarded beddings, linen, chemical waste, microbiological waste, okay, cytotoxic drugs, okay, cytotoxic drugs, all of them are going to go into yellow. Masks, they are going to go into yellow bag. ठीक है, head cover, ठीक है, head cover, yellow bag. Or if you talk about shoe cover, all of this is going to go into yellow color bag. And yellow category के लिए what is the mode of disposal, everybody? Incineration. If that is not available, plasma pyrolysis. If that is not available, like in remote or rural areas, we can go for deep burial. ठीक है, incineration हो गया, then plasma pyrolysis, deep burial. ग्लव्स का रैपर. नाउ गुड क्वेश्चन राहुल. देखो रैपर किसी भी चीज का इज अ जनरल वेस्ट. ओके, रैपर ऑफ एनीथिंग इज अ जनरल वेस्ट राहुल. लाइक रैपर ऑफ अ फोलीज कैथेटर. ओके, फोलीज कैथेटर. और रैपर ऑफ अ ग्लव्स. ठीक है, रैपर ऑफ अ ग्लव्स. और रैपर ऑफ अ नीडल. Okay, wrapper of a syringe. Okay, all this become your general waste. So where are they going to go into? Black bag. And black is not a biomedical waste category. Okay, remember that. Red, solid contaminated recyclable plasters or plastics or rubber. White में sharps है. Black, blue में glasswares and metallic body implants. ठीक है, remember that also. Red को how do you dispose of the contents of red? Autoclave, microwave, okay, you can also hydrowave it. ठीक है, hydroclave it, okay, and then you will send it for recycling. Sharps को आप क्या करते हो, ड्राई हीट स्टेरिलाइजेशन, ओके, जस्ट अ क्विक रिमाइंडर. एंड ब्लू बैग के कंटेंट्स को क्या करते हो, ब्लू इज द ओनली कलर बैग विच इज फर्स्ट डिसइंफेक्टेड, ओके, एंड देन autoclaved, and then you can also send it for recycle. So blue is the only color bag which is first disinfected, okay. All right, chalo. Ujjwala scheme is for the prevention of child abuse, child trafficking, child labor, child marriage. Bolo. Very good. So Ujjwala scheme is for child trafficking. 5 important components of Ujjwala scheme. Okay. So in this we were talking about child and woman trafficking. So prevention, rescue, rehabilitation, reintegration and repatriation. Repatriation is like making them feel part of the society again. Okay. So that is Ujjwala scheme. Here I have written for you. Ujjwala is prevention of trafficking and rescue, rehab and reintegration of victims of trafficking and commercial sexual exploitation. Ujjwala क्या है? Providing LPG connections to women from below poverty line. Ujjwala. And Ujala we all know is Roshni. So Unnati Jyoti by affordable LED bulbs for all. Okay, we have to promote efficient lighting. So Ujjwala scheme is important. Okay, next one. At a PHC, how do you do a vaccine storage? At a PHC, vaccine storage is done in vaccine carriers, ILRs, walk-in cold rooms or cold boxes. What is your answer? Think carefully. PHC बोल रहे हैं, PHC. You will always store in a ILR, guys, right? Vaccine carrier is used to carry out sessions at sub-centers and villages, okay? So let us make a small this thing. Please remember, look at this. We are going to quickly talk about storage of vaccines once, okay? This is an important topic. All right, so at the lowest, you have sub-center and villages, okay? Then you have PHC. Then you have CHC, sub-district hospital, district hospital. Then you have national or regional level. Here you can draw a line. Okay, so here you can draw a line. At sub-center and villages, you can never store the vaccine. You have to carry out a session there. You have to carry the vaccines there. So you can use a vaccine carrier and also a day carrier and also ice packs. Now remember, vaccine carriers can maintain the temperature for 24 to 48 hours. Day carriers also 24 to 48 hours and ice packs 1 to 4 hours. Now vaccine carrier is lined by 4 ice packs. Okay. Day carrier is lined by 2 ice packs. Okay, just for your knowledge. And vaccine carrier can carry 16 to 20 vials. Day carrier can carry 6 to 8 vials. Okay. Okay. Now in PHC, you have small ILRs, ice line refrigerator, maybe up to 140 liter capacity. This can maintain the temperature of the vaccine for only 1 month. Okay. And at the PHC, you also have small DF. DF means deep freezers. Now, what is the temperature of deep freezer? Minus 15 to minus 25. Now, what are deep freezers meant for everybody? Deep freezers किसके लिए होता है? Can you tell me? Deep freezers. Deep freezers में we are going to prepare ice packs. Okay. Now, if you talk about CHCs and sub-district hospitals and district hospitals, here you have large ILRs. So that is up to 300 liter capacity. This can again maintain the temperature of the vaccine for 1 month. And in large deep freezers, again you are preparing the ice packs. But Only at national and regional level, guys, we have walk-in cold room and walk-in freezers. Walk-in cold room is for the vaccines. They can maintain the temperature of the vaccines for up to 3 months. Okay, so many times students get confused. They say that in a district hospital or a sub-district hospital we can maintain the temperature of the vaccine up to 3 months. No, in a district hospital, CHC, sub-district, you can maintain the temperature only up to 1 month. So if you look at this diagram, this image, where is maximum chance of failure of cold chain? Batao. Maximum chance of cold chain failure. Where is maximum chance of cold chain failure, everybody? So maximum chance of cold chain failure is at sub-center and village level. Okay, the maximum chance of failure of cold chain is at sub-center and village level, because you cannot store your vaccines there. So be very careful with the image that I have, this diagram that I have drawn for all of you. It can definitely turn up in your exams. Okay, so question was, at PHC vaccine is stored in ILR. Cold boxes are used to carry vaccines from the site of manufacturer to the site of use. Okay, all right. Next, which of the following is an indicator of severity or lethality of the disease? Now there are two indicators that you have to note. Okay, three indicators in fact. What is this? Severity or lethality, proportional mortality rate, case specific death rate, case fatality rate, or total deaths due to that disease. Okay, very good. So the answer to this is case fatality rate. Yes, the answer to this is case fatality rate. Okay, the answer is case fatality rate. Now I'm going to just give you a few points. Please remember, when you talk about, let's write it in a clean page. Okay, when you talk about proportional mortality rate, or before proportion, what is crude death rate, guys? What is crude death rate? Just an important formula. Crude death rate. Now this is total number of deaths per thousand. Now this is death rate. So mid-year population. Okay, total number of deaths per thousand mid-year population. That is what is crude death rate. If I ask you what is, whenever it is death rate, your denominator has to be mid-year population. Okay, then proportional mortality rate. What does this mean? That whatever is the total deaths, okay, out of the total deaths, how many deaths happened, let's say, due to a disease X, multiplied by 100. So proportional mortality rate is the simplest measure of burden of disease. ठीक है? That is, no, not live birth. Live birth यहाँ पे कहीं पे भी नहीं है. Live birth is not here. Okay, dear. Death rate में it's always mid-year population. Proportional mortality rate due to any disease X means out of the total deaths, how many deaths have occurred due to a disease X. So this is the simplest measure of burden of disease. I am not saying the best. Best measure is DALI, but simplest measure of burden of disease is proportional mortality rate. And one, you have case fatality rate. What is this? So whatever is the total cases due to a disease X, उसमें से how many deaths due to X, or how many severe cases due to X multiplied into 100. So this is a measure of severity or virulence. देखो, maternal mortality rate में Rate में numerator has to be a part of denominator, Rafiq. So when you talk about maternal mortality rate, the numerator, maternal deaths, has to be a part of denominator. So it becomes women of reproductive age group. But when you talk about maternal mortality ratio, numerator cannot be a part of denominator. Then your denominator is live births. Okay. So here case fatality rate is a measure of virulence or severity of a disease. Which is a measure of communicability of a disease? Anybody? Which indicator is a measure of communicability, or for that matter transmissibility of a disease? बताओ कौन सा indicator है? Good evening. Yes, that is, which one is a measure of communicability or transmissibility of a disease? Anyone? Which indicator is a measure of that? That is secondary attack rate. Okay, secondary attack rate, everyone, is a measure of what? This is a measure of communicability or transmissibility of a disease. Okay? All right, moving to the next one. School health guideline, again one of the favorite topics. So can you tell me the answer to this? True about school health guideline. Minimum area 5 square feet per student minus desk type, can allot 60 students per classroom. Light is coming from the front of the classroom. So what is the answer to this? I asked you true. So rest all are false, minus desk type. Okay, so let's have a look at school health guidelines. So there are some recommendations for school health, everybody. School health guidelines, as you can see over here. One classroom can accommodate less than 40 students. Minus type desk at a lower level. Doors and windows more than equal to 25% of floor area. One urinal up to 60 students. One latrine up to 100 students. Light has to come from the left side. Why? Because most of us are right-handed. So natural light should come from the left side. Minimum area has to be more than 10 square feet per student. And which committee gave the concept of school health guidelines? Please remember Bohr committee. Okay, Bohr committee gave the concept. Okay, gave the concept of school health. ठीक है, Bohr committee gave the concept of school health. Then it was improvised by whom? It was improvised by Renuka Roy. ठीक है, Renuka Roy ने improvise किया, and she said that school health checkup should happen once every 4 years. But current guidelines says school health examination once every 6 months. Okay, school health again is an important question. Okay, many times this question has come in different exams. A nurse one second. Yeah, a nurse spilled blood on the floor. What can be used to disinfect it? What is your answer? Very good. 1% sodium hypochlorite. Glutaraldehyde and all these things are for instruments, guys. But if it's a larger spill, okay, if it's a very large spill, for small spill 1% ठीक है. Large spill है, then up to 10% sodium hypochlorite can be used. Okay. All right, a factory worker had a history of frequent exposure to groundnuts. Subsequently, he developed hepatocellular carcinoma. Now, again, this is a topic of food adulteration. Okay, food adulteration. A lot of question comes. So, groundnut, a factory worker had a frequent exposure to groundnuts. Subsequently, he developed HCC. Why? Because groundnuts get infested with which fungus? Aspergillus flavus. And what is the toxin that they release? That is aflatoxins. Okay. What is the sanguinarine? Okay, I'll show you some images if I have. Which food adulteration is this here? Which is an image of this? Which is this? Which image is this? Can someone tell me ये कौन सा image है? Very good. This is letharism. Now letharism में it is most in humans we only see neuroletharism. ठीक है, humans में सिर्फ neuroletharism होता है, no osteoletharism. Okay, and this is what has happened. Consumption of which dal, everybody? Khesari dal. Khesari dal, or it is also known as Lathyrus sativus. ठीक है, and this dal has a toxin what? This dal has a toxin boa. ठीक है, and please remember beta oxyl aminoalanine. This khesari dal has been banned. Okay, the crop has been banned, but it's still illegally grown. Okay, and khesari dal looks similar to which dal? Khesari dal looks similar to arhar dal. Okay, so many times we mix arhar dal with khesari dal. It's still illegally being grown, and that can lead to letharism. Spastic paralysis है इसमें, not flaccid, spastic paralysis. And like you can see here, it is a one stick stage. It can be a one stick stage, it can be a two stick stage, crawling stage, यहाँ पे one stick stage. Okay, now vitamin C was used for prophylaxis. Vitamin C was used for prophylaxis. Some of the important questions that can come. This is khesari dal. Okay, this is a very commonly asked question, so I'm revising it. Khesari dal. It just looks like arhar dal. Now, what is this? Which food adulteration image is this, guys? So this is, इसका नाम क्या है? What has happened to these children? What is this? You can see that they have bilateral non-inflammatory pitting edema. ठीक है, good evening Krishna. Okay, so bilateral non-inflammatory pitting edema. So इसमें क्या हुआ है? This is epidemic dropsy. Okay, epidemic dropsy. What happens in this? Now you have seen mustard flowers. They are yellow in color, mustard crop. Okay, now next to it a weed grows, which is Argemone mexicana. Okay, and because of that epidemic dropsy happens. So it is contamination of, okay, what is happening? Contamination of mustard oil with argemone oil. And what does argemone oil have? Argemone oil has the toxin which is known as sanguinarine. Okay, so very important question which can turn up in exam. This also leads to cardiac failures, glaucoma, as well as death. ठीक है, this beautiful yellow flower is actually a weedy flower and it's a very dangerous flower. This is Argemone mexicana flower, guys. Okay, what is it? Argemone mexicana flower. ठीक है, all right, chalo next one. A medical officer examines workers in mines and diagnosed silicosis. What should be his comments? It is reversible once we remove the cause. It takes 6 to 10 years to develop. Fibrotic changes in the lungs of the patient can be reversed. TB screening should be done at regular intervals. So silicosis. What are the important points with silicosis? Now, is any occupational disease reversible once we remove the cause? No, not reversible. Okay, it's not, whatever damage has been done, you cannot reverse them back. ठीक है, आप उसको reverse नहीं कर सकते. Not reversible even on removal of exposure. ठीक है, it is not reversible even on removal of exposure. If we remove the exposure, then also it is not reversible. And the changes in the lung can be reversed? No, they cannot be reversed. Also, please remember, for occupational exposure, whatever changes have happened cannot be reversed. And even if you remove the cause, the person can still go on to develop the changes. It takes 6 to 10 years to develop? No. Any occupational disease will take at least 10 to 25 years to develop. But silicosis may there is a high chance of the patient developing TB. Okay, silicotuberculosis. Okay, one occupational exposure that puts the person at risk of TB is silicosis. So read this. Mainly due to exposure of silica dust, we all know a dangerous sign is 0.5 to 3 micron. Now silicosis is seen in sand blasting industry. Okay, sand blast industry, pottery industry, okay, ceramic industry. Okay, then like here even in this thing glass, all these we get exposure to silica, can occur within a short period. Now here it says it takes 6 to 10 years, so it ideally has to take more than that, but TB screening should be done at regular intervals because it is associated with silicotuberculosis. Okay, next one everybody. Death registration must be done within, what is your answers? Very good. 21 days. This is, we are talking about civil registration system. Now remember, this is the least efficient, okay, least efficient health information collection system. Least efficient health information collection system in India. And birth registration 21 days, death 21 days, marriages 30, 60, 90 days depending on the state everybody. Birth registration is the responsibility of the hospital conducting delivery. ठीक है, अगर सब सेंटर में हो रहा है, so it's the responsibility of the staff of the sub center everyone. ठीक है, child born to NRI couple abroad, birth registration should be done within 60 days of arrival. Okay, so this is it. Which is the most efficient health information collecting system of India? Most efficient health information collection system in India. सबसे अच्छा, very good. The most efficient is sample registration system. Very good. Which is a dual recording system. Very good. You have a part-time enumerator as well as a full-time enumerator. Also remember, a question has come. SRS provides us data on crude birth rate, crude death rate, IMR, MMR, NMR, ठीक है, annual growth rate. All these data is provided to us by SRS. Every year SRS का data आता है, ठीक है, every year the data of SRS is released. Okay, it is conducted every 6 monthly, but the data is released every year. ठीक है. Okay, next one, updates on AIDS. Treatment of AIDS, ART is started at CD4 cutoff. What is your answer? Very good. So now there is no cutoff. Please remember, treatment of ART initiation, pehle there used to be a cutoff, but now it is started irrespective of CD4 count at any age, any stage, any group. Normally CD4 count is 900 to 1400, and if one starts getting below 500, then opportunistic infections start. Opportunistic infections kab aata hai? When the CD4 count comes below 500. But ART initiation has to be started irrespective of CD4 count. As soon as the person is HIV positive, start ART infection. Now, which is the most common opportunistic infection in HIV in the world? So remember, that is pneumocystis carinii pneumonia. But which is the most common opportunistic infection of HIV in India, everybody? Most common opportunistic important question. Guys, can you hear me? Hello, can you hear me, everyone? Okay. All right. Yeah, I think you can. Okay, so Nigar is saying D, Alia is saying D. Okay, let's continue. So, a government school in rural village was checking all students for their health condition. ये विजन 2020 क्या है? विजन 2020 is a worldwide initiative WHO to remove all the right to sight. Okay, vision 2020 is not an initiative of India. Okay, it's globally an initiative. This is right to sight. Okay, and in vision 2020, what are the diseases included globally? Cataract, refractory error, low vision. Now please remember, cataract is the most common cause of blindness in India also, worldwide also. Cataract is the most common cause of visual impairment also. Okay, so cataract, refractory error, low vision, childhood blindness. Most common cause of childhood blindness is vitamin A deficiency, trachoma and onchocerciasis. Okay, globally, but this is not in India. In India, you have same cataract, refractory error, low vision, childhood blindness, trachoma. Now, trachoma is in India, it is focal trachoma because infective trachoma has been eliminated by use of safe strategy. But in India, we have 3 extra diseases: diabetic retinopathy, glaucoma, as well as corneal blindness. Okay, so in India, altogether, you will be remembering 7 diseases. Globally, we have 5 diseases. Please remember this. This is important. Onchocerciasis of India may eliminate ho gaya, so that is not present. Okay. Then, how have we built the structure? You can see at the lowermost, we have at primary level, we have 20,000 vision centers, 1 per 50,000. 2,000 service centers, 1 per 5 lakh. 200 training centers, 1 per 5 million. Then at higher levels, ठीक है, center of excellence 20, 1 per 50 million, and 2 is the apex, 1 per 500 million. So please remember, vision center is very, very important. Vision center is at primary level, PHC level पे होता है, where there is a paramedical ophthalmic assistant. So he is going to screen, okay, screen for refractory errors. At the service center, guys, okay, which is at secondary level, you will have cataract surgery के लिए an ophthalmologist. CHC and all में you can have a service center. Training centers are for providing training and all of that. So that is in the opthal department of medical colleges. Okay. So if you look over here, where will the teacher refer the school child to? What is your answer? So the first is vision center. Vision center for refractory errors. Okay, where? Who is going to be posted? Paramedical ophthalmic assistant. Yes. At what cutoff will she refer? Very good, Rafiq. Vision, agar cutoff is less than, visual acuity is less than 6/9, the school teacher is going to refer the child to a vision center. Clear everybody? ठीक है. Training service centers में we are providing services like for cataract surgeries and all that. Training center में research activities होती हैं and सबसे ऊपर होता है center of excellence. Okay, so you must know the diseases under vision 2020. You must also know the setup. Okay, next, again a pretty decent and an important question, guys, which is, which of the following is a mortality dependent fertility indicator? Okay, so most of you are writing C. C is absolutely correct, guys. अब देखो, total fertility rate is how many children a reproductive age couple is going to have, total fertility. So this is an indicator of complete family size. Okay, what is the meaning of family size? Please remember, family size means the number of children. It doesn't include parents. Like if this is a couple, okay, father, mother, they have a boy and they have a girl. So if I ask you what is the family size, it's the total number of children. So the family size here becomes 2. Okay, so total number of children any reproductive age couple is going to have throughout their reproductive lifespan. Gross, and here we consider current fertility only. Okay, we consider what? Considering current fertility pattern. What do we consider? Current fertility pattern. But if I ask you gross reproduction rate, gross matlab, yes, family size doesn't include the parents. Okay, very good, Arya. Now if I ask you gross, G for girls, so it is not the total number of children, but it is simply total number of girls a reproductive age couple is going to have throughout the lifespan, considering the current fertility. But net reproduction rate is total number of girls, but throughout 15 to 49 years, but you will also consider current fertility, and what else? You will consider current fertility and mortality pattern. Okay, so you're going to consider current mortality pattern also. So mortality dependent fertility indicator is net reproduction rate. Is it clear, everyone? Okay, now please remember a few golden points. Okay, and general fertility rate kya hota hai? See, the first one is CBR, crude birth rate. What is crude birth rate? Let's just quickly revise the fertility indicators because it is a favorite topic in FMG exams, also in NEET PG exams. Crude birth rate is live births per 1,000 mid-year population. Now this is a simplest measure of fertility. Okay. Then you have, now why is it crude? Because do you think everybody in the denominator mid-year population can give birth to a baby? It also includes a male population and other everybody else. Okay, so it is just giving us roughly an idea. So then we have GFR. What is GFR? General fertility rate. What does GFR means? The numerator is the same, total number of live births. We'll make it a little specific, per 1,000 women in reproductive age group. Okay, so that is 15 to 49 years. Okay, and there is one more, GMFR, general marital fertility rate. वो क्या हो जाता है? Now everybody in the reproductive age group cannot very willingly give birth, so we consider married women, which is total number of live births. Okay, total number of live births per 1,000 married women in reproductive age group. Okay, understood? First one is CBR, crude birth rate. Every live birth per 1,000 mid-year population. Now it's crude because everybody in the denominator cannot give birth to a baby. Then we have second, general fertility, where denominator becomes women in reproductive age group. Now again, reproductive age group ko make it a little more specific, married women in reproductive age group. Then you have TFR. TFR is total children. Okay, total children throughout 15 to 49 years. Okay. GRR, gross reproduction, instead of total children, it is total girls. Okay, total girls throughout 15 to 49 years. Then what is NRR? Total girls alive. Considering feticide and infanticide, total girls remaining alive. So NRR में we considered mortality. Is it clear? Okay, this is very, very important. NRR is the most sensitive indicator of family planning achievement. Okay, most sensitive indicator of फैमिली प्लानिंग अचीवमेंट. सबसे पॉपुलर इंडिकेटर तो TFR है, बट मोस्ट सेंसिटिव इंडिकेटर ऑफ फैमिली प्लानिंग अचीवमेंट इज NRR. गॉट इट एवरीबडी? ओके, चलो वन मोर क्वेश्चन लेट्स ट्राई आउट. What is the answer to this? All about quarantine are true except absolute quarantine is restriction during incubation period. Okay. Exclusion of children from school is an example of modified quarantine. Quarantine should not be longer than the longest incubation period. Quarantine is done for the period of communicability. What is quarantine and what is the wrong statement here? Okay, good, good. Many of you are putting your answers. Good. So guys, I'll just quickly tell you a difference between quarantine and isolation. Okay, most of you are saying B. No, B is absolutely correct. Okay, the galat answer is, wrong answer is, quarantine is done for the period of communicability. You don't quarantine for period of communicability. Period of communicability के लिए isolation होता है. ठीक है, you isolate a person till the period of communicability or till the person recovers. Okay, आप उसको quarantine नहीं करते हो, you quarantine for the maximum incubation period of the disease. Okay, so let me just write over here, there are two terms, quarantine and there is a term isolation. ठीक है, so quarantine किसके लिए करते हैं? Quarantine is done for healthy contacts. Okay, and isolation is done for cases. Quarantine is done till the maximum incubation period of the disease. Okay, it is done for the maximum incubation period of the disease. What do we call this? Absolute quarantine. But isolation is done for period of communicability or till the person recovers, guys. Okay, it's done for period of communicability or till the person recovers. Quarantine is primary level of prevention, it's a risk, but isolation is a form of treatment, so that is a secondary level of prevention. Remember these important points. ठीक है, isolation हो गया तुम्हारा secondary level of prevention. And also, what is modified quarantine? Modified quarantine, everybody, is partial limitation of movement. Okay, maximum incubation period tak absolute quarantine, but there is a term known as modified quarantine. And what is modified quarantine? Modified quarantine is partial limitation of movement, like children over here. Exclusion of children from schools is an example of modified quarantine. Okay, so let's read it. Absolute quarantine is restriction during incubation period. Absolutely correct. Maximum incubation period tak, ठीक है, restriction during maximum IP. Exclusion of children from school is an example of modified quarantine. Yes. Quarantine should not be longer than the longest incubation period. Yes, it's done for maximum incubation period. And isolation is done for the period of communicability. Okay. Okay, let's do one more question for the day. A researcher wants to evaluate the effect of a new diet regimen on a weight of group of 10 students. He records their weight before and after the regimen. Which of the following test will be applicable? Very, very important topic to end the class with. बताओ ये क्या है? Which topic it is? Test of statistical significance. Okay, now how will you decide whether you have to select a parametric test or a non-parametric? What have we learned in classes, guys? हम कैसे decide करते हैं that we have to use a parametric or a non-parametric? Okay, Rahul says paired t-test. Idiopathic fun says chi-square. Rafiq says paired t-test. Now, first of all, the important thing is, whenever you have to figure out whether you're going to use a parametric or a non-parametric, look at your outcome variable. What are you looking at, guys? Weight. Now, weight is quantitative or qualitative? Weight is quantitative or qualitative? Weight is quantitative variable or qualitative? Weight is quantitative. Yes. Why quantitative? Because weight can be measured, meaning weight has a unit. Measured matlab it has a unit like kg, gram, whatever. And weight can be compared. ठीक है, weight को आप measure भी कर सकते हो and weight can also be compared. So weight is quantitative. Whenever you have to use a quantitative, you have a quantitative, you'll use a parametric test. In parametric, you only have to remember alphabets. Like there is a T test and there is an ANOVA. Now T test में you have paired for a single group. Okay. And you have unpaired for 2 groups. And when do you have ANOVA? For more than 2 groups. Whenever you have quantitative variables and you have to compare means and SDs, you will use a parametric test. Now in this, please remember, एक paired t-test होता है where we have a single group. Like here, in a group of 10 students, effect of a new diet on weight. So weight is quantitative and we are trying to do it for a group of 10 students. That means there is a single group. So you are checking the weight before a regimen and after a regimen. So which test will you use for a single group? Paired. Alright, everybody, did you understand? We'll use paired. If it was for 2 groups, unpaired. If it was for more than 2 groups, ANOVA. Okay? So this is very, very important. Please don't mess it up. It's an important question which can come in your exam. I'll just write one more thing. The difference between a parametric and a non-parametric test. Okay? Remember, parametric is for quantitative variables. Non-parametric is like qualitative, like gender, religion, breast cancer, disease. Okay, so they are for qualitative variables. Okay, parametric is parametric तुम्हारा use होता है when we have to compare means and SDs. Okay, but when we have to compare, we can express things in percentage and proportions. We will use a non-parametric test. Parametric is for normal distribution, okay, and non-parametric is for which distribution? Skewed. Parametric, everybody, is more powerful. Non-parametric is for less powerful. Okay? These are some of the points. Now, if you look at the first option here, chi-square. Chi-square is a non-parametric test. Okay, Rafiq? I'll be doing questions relating to that also. Like suppose you have to talk about obesity and breast cancer. Which test will you use? So now breast cancer is quantitative or qualitative? It is qualitative. It can be expressed in percentage. Okay. And then we make 2 groups. Okay. Breast cancer, yes, no. Obesity, yes, no. So the most common non-parametric test which is used to compare percentages and proportion is chi-square. Okay. We will be talking about it in detail also for today. Remember, parametric, quantitative, non-parametric, qualitative. Okay, means SDs, parametric. 1 group, paired t-test, 2 group, unpaired, more than 2 groups, ANOVA. Alright. So I think that's it for today, and I hope you've revised a lot of things. We'll be coming up now that the exam has been postponed. We will be coming up frequently with such sessions where you can practice MCQ with me. Alright. Also guys, please don't forget, Unacademy has is giving the Unacademy Combat Everyone, which is happening on the 27th of January, 27th of November, everyone. This one, please don't forget, do take part in this. It's absolutely free, amazing offers. Okay, so please link here description box mein, I hope. Just click on the link, enroll, use PSM 10 to enroll, and 500 lucky participants will win gift vouchers, top rankers, exciting rewards and scholarships. So that's an amazing opportunity which you should definitely avail. Okay. Thank you so much guys. Have a good day and keep revising, keep studying. I'll see you soon. Bye-bye. Have a good day.